Kurdistan Save the Children is a non-profit NGO that aims to ensure that all children, regardless of gender, ethnicity, and country of origin or religious belief, have the means for survival, receive protection, and have access to nutrition, primary health care, and basic education. We work to ensure a better future for all children, with a wide approach to the many aspects of their lives. Cleft lip and cleft palate is a birth defect that occurs when the lip and the mouth of a baby is not fully formed during pregnancy. Dr Brian Sommerlad, a world's leading consultant plastic surgeon for cleft lip and palate from Great Ormond Street Hospital, UK, came to Kurdistan to help KSC provide a better future for these children.
My name is Brian Sommerlad. I'm a plastic surgeon. I was invited here by the plastic surgeons whom I'd met, and a lot of what we've done here has been looking at some difficult cases. Some patients have been operated on in other parts of the country, sometimes by surgeons who are not very well qualified to do this kind of surgery, and trying to see if we can do something to help them, and also giving some suggestions about how the original operations, the operations to the babies when they're very young, how that can be made better, made more effective, more successful.
Dr Sommerlad is one of the famous, or one of the top cleft lip palate surgeon in the world. We wanted to invite him also to have mission also in Kurdistan, and we are really very lucky because this is his third mission to Kurdistan. His mission has three aims. One of them is capacity building of the plastic surgeon, workshop and training, and also surgery for the children.
لێوی هەبوو ئەمە کەروێشکی کەروێشکەدە بەڵێ ئیتر تۆزێ بەڕاستی ناڕەحەت بووین شتیوامان نەبینی بوو ئیتر بردیان لە خەستەخانە لەوێ دوو ڕۆژ مایەوە دوایی سەردانی کاک دکتۆر دانام کرد دکتۆری جوانکاریە چوینە ئەوێ دڵخۆشی دایانەوەتی زۆر ئاسایی ئەمە زۆرە بەڵام چارەسەریشی ئاسانە بالفعل دوای سێ مانگ چوار مانگێک سەردانمان کردەوە عەمەلیاتێکی ئێرەی کرد ئەتوانم بڵێم زۆر نەجاعەتیە.
وەڵای من دەمێکە سەردانی مناڵ پارێزەکەم بەس لە دووەم عەمەلیات کە کردوومە دکتۆر ئاریبەی کردووم سوپاسی مناڵ پارێزەکەم چونکە مناڵ پارێز مەسرەفی عەمەلیاتی دووهەمیان بۆ کردووم. ئێستاش کە هاتووم ئەمەیە بچێتە لای دکتۆر سۆمرلاند و بەڵکو شتێکم بۆ بکات چونکە ناوقورگی زۆری ماوە قسە و شتی وشی وازان نییە بەڕاستی بێگومان نەشتەرگەری زۆر ماوە بەڵام ئەوەی کە لای من زەرورە قورگێتی و قسەکردنێتی چونکە لە هاوپۆلەکانی خۆیاڵێک داڵتەم پێیەکەن جاری وای لە قسە و شتم تێناگەن وازە نییە لەلایەن لەبەرەوە ئەسا هەز بە نەقسێکەکە جا من زۆر سوپاسیانەکەم ئەگەر هاوکاریەکم بکەن بۆ چاکبوونی ئەو مناڵە.
Well, there are various types of clefts. You can have a cleft just of the lip, or only of the palate, or you can have a cleft of the lip and the palate, and it can be one-sided or it can be both sides. The most important part of the treatment is the original surgery, the surgery that's done when these patients are very young, and it's quite difficult surgery, and I think it takes quite a lot of experience before you get reasonably good at doing it. It's never perfect, the results are never perfect, but we're aiming obviously to make the results as good as possible. And I think a lot of the problems are caused by surgeons who don't have the experience or don't have the expertise, and they can do a lot of damage. It's possible to damage the important structures, damage the muscles that produce speech, damage the growth of the upper jaw, and those problems are very difficult to correct. So if you don't get it right at the beginning, it's very difficult to get it right later on.